In this episode, you'll discover the role that fasting plays in healing from chronic or terminal illness and learn how you can implement it safely and gently today. You've been told it's incurable, but here at Renegade Remission, we believe in rewriting the story. If you're facing a terminal or chronic illness, you are not alone. I'm Eleni Welch, certified nutritionist, and each week I share healing strategies and remission stories to help you take control of your health, feel better, and rediscover hope. Welcome back to Renegade Remission. By the end of our time together today, you'll understand the science behind how fasting and metabolic therapies influence inflammation, immune function, and cellular repair. You'll learn why some long-term survivors include fasting in their healing strategies, and you'll hear a real case in which fasting played a meaningful role alongside standard treatment. I'll give you simple, safe ways to support your metabolic health without extreme fasting, rigid rules, or anything that places unnecessary stress on your body. If you've explored the world of nutrition or healing, you've probably heard terms like fasting, metabolic therapy, ketogenic diet, or energy metabolism. Some people talk about them as if they are miracle cures, and others warn that they are dangerous and unsustainable. But like most things in medicine and healing, the truth lies in a pretty nuanced space between those extremes. What we know is this: metabolic therapies like fasting are not necessarily cures, and they shouldn't replace evidence-based treatments. Yet the scientific literature does show that adjusting how the body produces and uses energy can shift inflammation, cellular repair, oxidative stress, and immune function in ways that may support the healing process, and quite effectively. Many people who experience unexpected stability or recovery describe gentle changes in how they eat, when they eat, and how they support their steady energy. They don't often describe extreme starvation or restriction. To ground this conversation, I want to begin with a real case study that helped ignite interest in fasting within the field of oncology and terminal illness. This is a case study of a glioblastoma patient, a type of brain cancer, who used metabolic therapy, including fasting, alongside his standard treatment. Glioblastoma multiforme is one of the most aggressive brain cancers known to medicine. Survival is often measured in months, even with the strongest available treatments. In 2010, researchers published the case of a 65-year-old woman undergoing the standard protocol, which included surgery, radiation, and chemotherapy, who also adopted a medically supervised, calorie-restricted ketogenic diet. The intention was to lower glucose availability and increase ketone production, creating a metabolic environment that glioblastoma cells usually struggle to use efficiently. In other words, it's sort of starving the tumor. Her medical team monitored her blood glucose and ketone levels closely while she continued therapy. After several weeks on the diet, MRI scans showed no visible tumor, which is a striking response. When the diet was later discontinued, the tumor recurred, indicating that the diet was the thing keeping it at bay. This story illustrates the biological principle that metabolism and disease behavior are deeply connected. Fasting and metabolic therapy are grounded in simple biological truths. When you adjust how the body produces energy, you influence how the body heals. Energy metabolism is tied to inflammation, immunity, mitochondrial function, oxidative stress, and even gene expression. Fasting stimulates autophagy, which is the body's cellular cleanup system, basically the internal housekeeping system your body uses to break down damaged proteins, malfunctioning mitochondria, and cellular debris. It's one of the most essential repair processes we have. A major review in the New England Journal of Medicine explains that fasting enhances autophagy, giving cells a chance to clear out what is dysfunctional so they can continue to function more efficiently. Increased cellular cleanup can support immune precision, mitochondrial health, and tissue resilience, particularly in conditions marked by oxidative stress or chronic inflammation. Time-restricted eating improves metabolic stability. Time-restricted eating means eating within a consistent daily window, often 10 hours or less, without necessarily reducing calories. In a 2020 clinical study involving adults with metabolic syndrome, a 10-hour eating window improved blood pressure, fasting glucose, lipid profiles, sleep, and daytime energy. Stable blood sugar and improved circadian rhythms create a biological environment that is far less inflammatory and far more supportive of healing. Stabilizing glucose reduces inflammatory load. Repeated glucose spikes strain the immune system and contribute to oxidative stress. A major review in BMJ found that diets emphasizing minimally processed, lower glycemic carbohydrates are associated with better inflammatory and cardiometabolic outcomes, while refined grains and sugars are associated with higher inflammation. This means that choosing carbohydrates that support steadier energy and fewer inflammatory swings is something that is especially important in chronic illness. Something else we've learned from science is that ketones influence inflammation and mitochondrial function. Ketones are not merely alternative fuel for your cells, they're signaling molecules that affect inflammation, oxidative stress, and mitochondrial health. A review in Trends in Endocrinology and Metabolism demonstrated that ketones can reduce oxidative damage, support mitochondrial efficiency, and modulate inflammatory pathways. This helps explain why ketogenic diets and fasting mimicking diets are being studied in neurology and oncology, because they act as metabolic modifiers that influence the terrain in which disease develops. Insulin-like growth factor is a hormone that promotes cell growth. While IGF-1 is essential for health, chronically high levels have been associated with increased inflammation and poorer outcomes in certain cancers. Research summarized in Nature reviews of cancer show that short-term fasting reduces IGF-1 and increases cellular stress resistance, potentially helping healthy cells better withstand stressors like chemotherapy. This suggests why some patients feel better or respond differently to conventional treatment options when metabolic strategies are included in their treatment protocol. Fasting and metabolic therapy are powerful tools. They may not be appropriate for everyone, and they may not always be considered a quote-unquote cure, but they can help rebalance an internal environment that has become overwhelmed by reducing inflammation, supporting mitochondrial function, encouraging cellular repair, and stabilizing energy metabolism. And the good news is that you do not need long fasts or extreme dietary rules to benefit. Most of the positive effects seen in the research we shared today come from small, gentle shifts like fasting overnight, reducing sugar and carbohydrate intake, spacing meals more consistently, and eating in ways that stabilize blood sugar. If you want to experiment with metabolic support, begin with steps that are gentle, safe, and widely beneficial. A simple 12-hour overnight fast, so finishing dinner at least by 7 p.m. and then waiting to eat breakfast until 7 a.m. can improve metabolic health without depriving your body. Reducing refined sugars and starches helps stabilize glucose and reduce inflammatory strain, and pairing the carbohydrates that you do eat with protein and healthy fats keeps energy steady. Adding nourishing fats like olive oil, nuts, seeds, avocado, and fatty fish reduces inflammation and supports mitochondrial resilience. You should never attempt extended fasting if you are underweight, losing weight unintentionally, inactive treatment, or medically fragile. Fasting should always be supervised in those situations. Fasting and metabolic therapy are powerful ways to support the biological processes your body is already trying to use to heal. When you stabilize blood sugar, support mitochondrial function, and allow your cells time to repair, you create a more healing-friendly internal environment, and your body often meets you with more resilience and more energy. In our next episode, we'll discuss detoxification, bust some myths surrounding it, and discuss how it could help in your healing journey. So stay tuned for that episode and go be renegades.